Chapter 9, Lesson 4, Body Image and Eating Disorders. Body Image and Eating Disorders. Big idea. A teen's body goes through many changes during puberty. Many teens gain or lose weight. Developing a positive body image. To develop a positive body image, try to remember the factors that influence your body image. These factors are both internal and external. An example of an internal influence is how you feel about the way you look. External influences include the things you hear from others and about how you look. For instance, family and friends can influence how a person feels about his or her body. Images from media can also have a strong influence. It is easy to feel like you do not measure up when you're comparing yourself to a star basketball player or a fashion model. Having a poor body image, in turn, can hurt your self-esteem. The truth is that there are very few people that have bodies similar to these of those athletes or models shown in magazines. Bodies come in all shapes and sizes. The way your body looks depends largely on your gender and characteristics you inherited from your parents. These factors are out of your control. Your growth stage affects your body shape too. Many teens grow in spurts, and often they will carry a few extra pounds for a while to prepare for the next spurt. Then they suddenly grow taller, and the extra body fat seems to disappear. Other teens may seem underweight because their bodies are using so much energy. To develop a positive body image, accept yourself as you are, focus on the things you like about yourself, avoid comparing yourself to an unrealistic body type, maintain a healthy body by eating an appropriate amount of food and getting enough exercise, spend time with people who like you and appreciate you for yourself. Show that you value yourself by taking good care of your body and mind. Eat well, get plenty of rest and exercise, and make time for activities you enjoy. Eating disorders. Main idea. An unhealthy body image can lead to an eating disorder. A person with an unhealthy body image may be at risk of developing an eating disorder, where if you click on the yellow highlighted, it will also give you that definition. Eating disorder, extreme eating behavior that can lead to serious illness or death. It is not known what causes eating disorders. However, people who feel bad about themselves or are depressed are more likely to develop an eating disorder. Eating disorders can affect anyone, but are more common to appear first during the teen years. Males and females can develop eating disorders. A person with an eating disorder is not getting enough nutrients to help his or her body grow. Eating disorders are very dangerous and can lead to death. Often, though, people with eating disorders may deny they have a problem. If you think that someone you know has an eating disorder, discuss the problem with an adult whom you trust. You can also help by encouraging your friend to ask for help. People with anorexia nervosa, an eating disorder in which a person strongly fears gaining weight and starves herself or himself. May feel a need to be very successful or be accepted by all people. They eat far fewer calories and they need to stay healthy. They may also exercise excessively. Even after they become extremely thin, they still see themselves as overweight. People with this disorder can become dangerously underweight. Also, Because they eat so little, their bodies do not get the nutrients they need to grow and repair themselves. Their bones may become thin and brittle from lack of calcium. Their blood pressure and body temperature may drop. If they do not get treatment, people with this disorder can literally starve to death. They may also die from heart failure, kidney failure, or medical complications. In addition, the depression that often comes with anorexia may lead to thoughts of suicide. Bulimia nervosa, an eating disorder in which a person repeatedly eats large amounts of food and then purges. They purge food in several ways. One way is to vomit or throw up. Another way is to use laxatives. People with this illness have a normal weight but still feel the need to go on an extreme diet. When they cannot stay on the diet, they suddenly eat large amounts of food. Then, after eating, they purge. They may also try to burn calories with constant exercise. Unlike anorexia, bulimia usually does not lead to extreme weight loss. Its signs are usually subtler. For instance, people with this disorder may often go to the bathroom after eating a large meal. While in the bathroom, they may run the water to cover the sound of vomiting. Another sign is swollen cheeks caused by vomiting. Bulimia is hard on the human body. It not only robs the body of nutrients, but it can also cause a lot of damage. The colon, liver, and kidneys may be damaged. The coating on their teeth may wear off because of the frequent vomiting exposes the teeth to acids from the stomach's contents. The linings of the stomach, esophagus, can also be hurt. The body may become dehydrated, meaning it does not have enough water levels it needs. Also, the heart may be harmed. Binge eating. Binge eating, an eating disorder in which a person repeatedly eats too much food at one time. Binge eating is also called compulsive overeating. A compulsion is something that you feel you cannot control. People with this disorder eat even when they're not hungry. They also eat enough to make them feel physically uncomfortable. They may eat alone so others do not see how much food they eat. They may hide food for the same reason. In some cases, binge eating may be an attempt to deal with depression. As you might guess, binge eating can lead a person to become obese. Obese, more than 20% higher than what is appropriate for their height, age, and body frame. Binge eating can develop all kinds of health problems related to being overweight. These include heart disease, diabetes, and some types of cancer. In addition, the guilt that compulsive eaters feel about the problem can lead to depression and low self esteem. Males and eating disorders. As you learned, eating disorders are linked to body image. People who do not like the way they look may try extreme measures to change their weight. When you think of anorexia or bulimia, extreme weight loss often comes to mind. Binge eating often leads to extreme weight gain. These disorders affect both males and females. Males and females experience similar signs and symptoms. A related disorder and an obsession with adding muscle. Muscle is dysmorphia, can also affect anyone, but it's more common in males. During the teen years, a girl may mistakenly think she needs to lose weight. A boy the same age might see himself as too small or not weighing enough. As a result, he may want to gain weight and add muscle. In addition to compulsive eating, this disorder can often involve the use of steroids or other dangerous drugs in an effort to bulk up. Eating disorders may be less noticeable in males and more difficult to diagnose. However, they are just as harmful and require similar treatment. Treatment for eating disorders. Eating disorders are a mental health problem. They can also cause serious physical harm. People with eating disorders need medical help to recover. Many types of healthcare providers work together to treat eating disorders. This includes doctors, counselors, and nutritionists. This healthcare provider can help the person rebuild his or her physical, mental, and emotional health. In extreme cases, a hospital stay may be needed to treat serious physical problems or severe depression. People with eating disorders often cannot admit they have a problem. Family members and friends can help them recognize the problem and seek treatment. If you are concerned that you or someone you may know have an eating disorder, talk to a trusted adult. A person with an eating disorder needs to get help right away. The sooner a person can get treatment, the better his or her chances are of recovering. Compulsive exercising is closely related to eating disorders. It is possible to become dependent or obsessed with exercise. Compulsive exercises may add extra workouts. They may force themselves to exercise when ill or very upset or missing a workout. The effects of the compulsive exercising are similar to eating disorders. Use online resources to learn about the warnings of compulsive exercising and find out what to do if you suspect you or a friend may have this disorder.
An estimated 36 million Americans suffer from eating disorders, which are extreme and damaging eating behaviors that can lead to sickness and even death. Binge eating is characterized by compulsive overeating. Because of the excessive amounts of food that binge eaters consume, they have serious weight problems and may be obese. An obese person's weight is more than 20% higher than what is appropriate for his or her height, age, and body frame. A second eating disorder is anorexia nervosa, which is characterized by self-starvation leading to extreme weight loss. The health problems that result from the lack of nutrients can eventually lead to death. Another eating disorder, bulimia nervosa, is a condition in which a person eats large amounts of food and secretly purges by vomiting or using laxatives. This disorder also causes serious health problems. All eating disorders require treatment, which involves a team of health professionals. Hospitalization is only necessary when the person's life is in danger.